Hey, gorgeous. Welcome to season 6 of the Hormone Puzzle Podcast. I'm your host, Dr. Kayla Smith, a holistic integrative doctor specializing in fertility and hormone health. If you're looking for insights into hormones, fertility, and all things related, you've come to the right place. Tune in weekly as we interview amazing experts in the field of women's health, breaking down those hormone walls, nerding out on nutrition, and having way too much fun. Whether you're beginning your journey or you've been struggling for years, we're finally going to help you put those pieces of your hormone puzzle back together so that you can get and stay pregnant and eliminate all your hormone-related symptoms for good. Are you ready? This season, we're focusing closely on fertility and hormone health with an amazing lineup of expert guests sharing groundbreaking knowledge, bringing you stories and advice that will support you in your fertility journey. We're here to lift your spirits, give you a virtual hug and inspiration, as well as empower you to take charge of your fertility and your health. Thank you so much for tuning in and for being an amazing listener. So now, let's get started on your road to transformation. Let's start piecing together your hormone puzzle one step at a time. On this episode, we have Rachel Sherriff. She is the founder of the Fertility Suite. Following her own journey with fertility struggles that led to her wanting to understand more about what could be done to support her own fertility and IVF cycle, the Fertility Suite was born. And it's a holistic fertility clinic based in Oxted, Surrey, offering fertility acupuncture, reflexology, and one-on-one assessments. Rachel and her team of 5 are passionate about helping couples to either get pregnant naturally or, if IVF is needed, helping them to prepare for the best possible outcome. They also work online globally with couples to offer advice and guidance. Rachel has been featured widely in various media publications and is passionate about fertility education. She also hosts the Fertility Suite podcast, which aims to share knowledge from fertility experts. The Fertility Suite also offers free resources to support your fertility, such as the Fertility Supplements Guide and Guide to Healthy Vaginal Microbiome. Today, we're talking to Rachel about understanding miscarriage and how to make a plan for a healthy pregnancy. Now, let's welcome Rachel to the podcast. Hey, Rachel, welcome to the podcast.
Thank you so much for having me, Kayla. Thank you.
I'm really excited to talk to you today. I know a lot of our audience members struggle with miscarriage, and so I just want to shine some light and some education around this, and so I think this is going to be a great show.
Yeah, hopefully, absolutely. It's definitely something that over in the UK we really need more support with. So yeah, I'm kind of really excited to get talking.
So let's just dive right in. Tell us a little more about you and how did you get into the work that you're doing?
Yeah, sure. So I, like a lot of people that work in the fertility space, I came to become an acupuncturist because I underwent fertility treatment myself. I had 3 rounds of IVF and eventually I was lucky enough to fall pregnant on a 3rd round with my son. And I kind of fell into that unexplained infertility bracket. And looking back, if I knew then what I know now, I may not even have needed IVF. Perhaps I wouldn't have pursued it quite so quickly. Obviously, it had a great outcome for me. So there's no regrets there. But looking back, I just think I didn't know anything. I was really uneducated. And after I had my son, I wanted to kind of like give back, I guess. And I was really passionate about helping other people to go through what I'd been through because it was a pretty horrendous journey. And I really wanted to build something that had purpose and to really help anyone that might be in the same situation. So I was really lucky at the time. I managed to take redundancy from the current job that I was in, and I used that sort of funding to restart and retrain. And I retrained in acupuncture. I'd had a lot of acupuncture throughout that 3rd round of IVF. And it was something I was really interested in, like the whole holistic side of medicine and all these alternative options. And yeah, I retrained and then I set my practice up. At first, I was just doing sort of general acupuncture practice. And then within a year, I sort of realized, no, look, I got into this because I wanted to specialize in fertility. And then, yeah, reframed the whole business to focus on fertility. And we now have quite a big holistic fertility clinic. There's 5 of us in the clinic, and then we work remotely with some other practitioners as well. And essentially we help people to have healthy pregnancies, no matter what that looks like, whether people are trying naturally, whether they're undergoing IVF, whether they've had recurrent loss, whether they are same-sex couples, anything, we're here for it. So that's what we do.
I love that. And I love that you took your journey and turned it into your passion and your career. And that's the reason I started my podcast. And I sort of did the same thing. I was diagnosed with unexplained infertility and was told I couldn't get pregnant without IVF. And I just said, wait a minute, I don't want to start there. I want to end there. And so I figured out, what do I need to do to get pregnant? And so that's what I did. So I love when people take their story and just turn it into their passion and help more people around the world. So that's amazing. Thank you so much for sharing that. And today we are going to talk about miscarriage. And so let's get into that a little bit. You say it's so important that we get a diagnosis around miscarriage. Tell me what you mean by that.
Yeah, it's a really good question, because you can't look back, right, and get a reason for a miscarriage a lot of the time. In some scenarios you may get an answer, but for the large majority of couples, you'll never understand why that miscarriage happened. But when we talk about diagnosis, really what we mean is in the right investigations being run to look at potential causative factors that can be sort of diagnosed. There's so many reasons for miscarriage, and they vary, depending on, I think the recurrent miscarriage picture is quite different to a single miscarriage. And I think when you get into the recurrent realm, there are other things that need to be considered. But there's so many reasons, and unless you really know the reason or you've done any investigation, you're not really minimizing your risk of another loss in future. And there's so much that can be done to help us understand. And there's often a link. So causes for miscarriage often overlap with causes for fertility problems. So certainly if a couple is actually struggling to become pregnant and then they're miscarrying, is there a common link there? What's going on? And how can we help support them to have a healthy pregnancy?
For sure. And let's talk about those common causes of miscarriage. What are you seeing in your clinic?
Yeah, it's very varied, but in no sort of priority order or no sort of specific order. Often chromosomal abnormality, that will be one of the most common reasons, and statistically that is one of the most common reasons for miscarriage. However, when you start to see this recurrent picture, I don't see that happening so much. If a couple has something like a balanced translocation where they're passing down like a genetic chromosomal abnormality, then yes, that can be implicated in recurrent miscarriage, but that's not something that's common. So in recurrent miscarriage, we tend to see more issues with sperm health, so high levels of DNA fragmentation that haven't been identified and therefore haven't been addressed. Often things that go undiagnosed in women, things like polycystic ovaries, where you have these other implications for fertility. Women who are polycystic are often quite fertile in that they've got good egg reserve. What's going on with their progesterone level? Is their lining thickening up enough? What's the egg maturity like? There's all these other factors to consider. Inflammation with conditions like endometriosis. Is the thyroid functioning properly? All these things often go missed. And one thing I often say to people is you don't need everything to be perfect. We just need things to be optimal. And if something's undiagnosed and it's not being addressed, whether that's from a holistic perspective or a Western medicine perspective, then you're going to have issues and you're going to have things that could potentially link to miscarriage and fertility problems.
For sure. Yeah.
Also got things like structural abnormalities, so issues with the uterus environment itself, so fibroids, polyps. Sometimes if women have had surgical management of miscarriage previously, they're at risk of things like Asherman's, bicornate uterus, and sometimes even after a healthy pregnancy, C-section scarring can cause an issue. And I think about 66% of women, I think is the statistics, who have had recurrent miscarriage or suffered with recurrent miscarriage will have signs of endometriitis, so inflammation within the endometrium. There's also been quite a few studies into the microbiome of the vagina and the uterus, and we know that if you have low lactobacillus levels, there is a higher chance of first trimester miscarriage. And then we've got other things that are slightly more complex, but can certainly be a common occurrence in things like recurrent miscarriage. You've got your reproductive immunology, your natural killer cells, and even sometimes blood clotting disorders. So you can really see how varied it is, right? So this is why I think doing the right investigations is key, because it's not good enough to be saying to couples, just try again. Because if there's something there that can be fixed and addressed, you're really going to minimize risk factors moving forwards and improve someone's chance of a healthy pregnancy.
Yeah. And it's not too, I always say on the show, I don't believe the unexplained infertility diagnosis is actually a real diagnosis. I feel like that's handed out way too often. And it honestly means that they just don't know. And so digging into some of these pieces that you mentioned, defragmentation for the men, the thyroid health, the hormone imbalances, the progesterone, it's all things that we need to identify and address if we want to improve our fertility outcomes.
Yeah, absolutely. And, I think we're getting better when it comes to helping people to become pregnant, in that certainly in the UK anyway, the net is widening a little bit, and you're starting to see tests that maybe 5 to 10 years ago weren't offered as easily are now more readily available. And we're starting to kind of lose that sort of tarnishing people with the unexplained brush. But I think we're still a little bit behind with miscarriage, and we still have this mentality and this sort of approach of saying to couples, well, it's just bad luck, just try again. And, if we're moving out of the realms of saying that to people for fertility, then it should be the same for miscarriage.
And where should somebody start if they are having, since this show's based around miscarriage, let's talk about that. If they've had one, or even they're having recurrent, is there a certain place you should say, okay, start here with this hormone testing or this, semen analysis? Talk to us about that.
Yeah, absolutely. The way we tend to work in our clinic is we screen people. So we essentially spend 90 minutes with them, asking them a lot of really in-depth questions to understand where to signpost them, because often there are signs of what might be going on. It's just that no one's done the right investigations or taken the time to screen them effectively. So we tend to take a bit more of an individualized approach. However, for the average listener, if they have suffered with recurrent miscarriage and they're thinking, look, I really want to do something, where should I start? I would start with something really simple, like a hormone blood test between cycle day 2 to 5, and looking what your testosterone is doing, what your estrogen is doing. Is your thyroid functioning properly? Is your prolactin normal? Running maybe some more in-depth thyroid tests if you have a diagnosed thyroid issue already, and really looking at if the function is optimal. And I say that just because so many women have thyroid issues, and often they're told it's not causing an issue, but when you scratch below the surface, it is. And then I would start with, for men, a sperm DNA fragmentation test. Often a lot of men are told they don't need investigation because the female partner is falling pregnant easily. And we can already make the assumption that a normal semen analysis will come back fine, because if someone is falling pregnant easily, then yes, the semen analysis will probably show the sperm are swimming quite well. There's probably plenty of them. It's slightly different if someone has a longer time to conception and they're really struggling. That would be when we really want to look more, at sperm motility, morphology, and the count. But if a couple are suffering with recurrent miscarriage, I would straight away be looking at a DNA fragmentation test, because this looks at the sperm at a deeper level, at the DNA integrity of the sperm. And it tells us that if you have DNA fragmentation above a certain threshold percentage, that you have an increased risk of first trimester miscarriage. And something I always say to couples is that it's a no-brainer to look at the sperm, because men constantly produce new sperm. So if we can identify an issue with the sperm and we can fix it, and often issues with sperm are totally fixable, then we can completely change the picture of the couple as a whole, because the sperm is 50% of the picture. And if you can improve the sperm parameters by 30%, that is a big difference for a couple in their fertility outcome. But it's something that's just not looked at enough. So those would kind of be my two key things. all of the other things that I mentioned earlier, I would say I would probably want to screen someone properly before I would recommend, because they start doing the things, certainly in the UK. I know in the States you have health insurance, so it's a little bit different. But in the UK, we still work with a slightly different system where we have the National Health Service and you pay for anything separately. So some of these things can be quite expensive. And I would never suggest that everyone needs to go out and get all of those things checked, because you're going to spend a large amount of money and ultimately you're going to be testing things that aren't relevant to you. But often, in my experience, if you're suffering with recurrent miscarriage, something will come up on the hormone test or something will come up on the DNA fragmentation. Other than that, often people will have clinical signs of other things. So, for example, if you have really light periods after a surgical management, that might tell us that maybe there is some Asherman's going on. There's normally other signs of more complex things.
For sure. And I love that, excuse me, I love that you mentioned that about identifying the whole person and spending all of that clinical time and really looking at them as an individual and their symptoms and how that matches what we're seeing clinically. We do the same thing within our clinic. I think it's so important. I find so many people will go to their conventional doctors, especially in the US, and they're getting 5 or 10 minutes and this full evaluation isn't being done. So it's so important. I'm glad you mentioned that. And I just want to tell our listeners, if you're going to a practitioner and that's not being done, then I would look for another practitioner that's going to dig a little deeper. Yeah. And so let's switch gears a little bit and let's talk about misconceptions. Any misconceptions or myths or anything you want to say that's just not true when it comes to miscarriage or recurrent loss?
Yeah, the main one really I think we hear all the time is it's just bad luck. It's just bad luck, just try again. And yes, it's possible if you have a single miscarriage, that certainly dependent on your age as well. It might be that maybe that month the embryo just wasn't genetically normal. We know that the older you get, the more chance you have of producing more genetically abnormal embryos than normal ones. So I think we do need to look at it in an individual context again. But if you're having recurrent miscarriage, often it's not just bad luck. And certainly when you're dealing with a couple who are younger, maybe in their early 30s, and they're having recurrent miscarriage, that's not normal. That's not bad luck. There is something undiagnosed going on there and it needs further investigation. So I think that's the biggest kind of myth that I hear time and time again, often sort of on the same sort of under the same umbrella there, is that it's egg quality, it's egg health. And again, it's, women are led to believe, oh, well, it must be my eggs. And, there's a huge male factor. 50% of that embryo is male DNA. It relates to the sperm. So we really need to be looking at men as well when it comes to miscarriage.
Yeah. And I love that you mentioned that too, about just the younger population. And I would say that too, not just for miscarriage and recurrent loss, but for fertility in general. If you're in your early 30s or even late 20s, I'm saying, and you're not getting pregnant after, a couple of tries, I would say something is going on and we need to investigate that, because at 30 or younger, you should be able to get pregnant with no problems.
Yeah, absolutely. It's always a bit of a red flag, and probably the same in your clinic, Kayla, that if you have a younger couple coming in, it's almost like it rings more alarm bells in your head, because we know that over 40, even over 38, right, it's going to be a little bit harder to get pregnant, and we really need to nail the basics and really make sure everything's optimal. And even then, there is a higher chance that things are going to be harder and you're up against it a little bit more. But when a younger couple comes through the door and they're suffering with fertility or miscarriage, then yeah, it's a big red flag. And straight away, I would start running tests.
Yeah, for sure. What about the emotional and mental side of fertility and miscarriage and loss? Any tips that you give to your patients around just how to manage those pieces?
Yeah, this is such a massive issue, right? And it's something that, again, in the UK, there's a couple of amazing charities. We've got the Worst Girl Gang Ever, we've got Tommy's, and they're brilliant and they're really supportive from the emotional side of things as well as the physical. I think something I see a lot is women telling themselves that they should feel a certain way and that they shouldn't feel upset because they fell pregnant in the first place, so therefore they should be grateful, or they're blaming themselves a lot of the time. And I think the key is just to be really kind to yourself. This is often a medical issue that needs some form of support. A lot of couples who are trying to get pregnant or are getting pregnant and miscarrying are already doing a large amount of things to be as healthy as possible. They're already nailing their nutrition, they're already nailing their sleep, because it's very easy to find out that information nowadays online about what you should be doing to support your health and your fertility generally. We're all very aware nowadays. And I think people beat themselves up, and just remember to be kind to yourself. Allow yourself the space. It's okay to feel angry. It's okay to be absolutely petrified about trying to get pregnant again, because all of our current fears and anxieties come from our previous experience. And if you have been through recurrent loss, of course you are going to feel super anxious and emotional and stressed when you're even thinking about trying to conceive again, let alone when you actually do conceive again. I think it's actually a bit abnormal to think that you could go into a pregnancy after loss feeling super positive and super happy. It's just going to be so difficult, right? Because of your previous experience. So just accepting that, rather than telling yourself, oh, I should be feeling positive, I should be feeling happy. Like, it's okay to feel the way you feel, right?
Right. And you can, feel however you want. And I always like to explain to our audience, you can share however you want to. You don't have to share your entire journey. That is your journey, and it's personal to you and your partner. So you can share what you feel comfortable with or what you don't feel comfortable, and that's okay. Don't ever feel like you need to share if you don't feel comfortable with that.
Yeah, no, I agree. I think especially nowadays when there's so much that's shared online, and a lot of people share their stories, right? And it's okay not to do that. Yeah.
And so if somebody is listening to this and they've had a miscarriage or recurrent loss and now they're ready to try again, what is maybe the one step you would say, okay, let's do this first before we start to try again?
In terms of like clinical diagnostics, or do you mean still like the emotional side of things, or?
Yeah, no, just in terms of a preconception plan moving forward after a loss. Where would you start first with that?
I would start first with your overall health and well-being. So make sure you're nailing those things I talked about. So having a well-balanced diet. Doesn't need to be perfect. Nothing needs to be perfect to have a healthy pregnancy, but making sure you are looking after yourself, having a regular sleep pattern. So your circadian rhythm is well regulated. You're exercising, you're getting out and you're getting sunlight, and you're spending time outside and moving your body on a daily basis. These are all things that we should all be doing for our overall health and well-being. So I would start with those things. If you're not doing those things, that's okay, but start making small changes so that you are giving yourself the best possible chance. And if you haven't run those tests that I talked about, so the hormone imbalance for women and the sperm DNA fragmentation for men, and you're feeling anxious and you want to look into things, I would do those 2 tests. It really depends on the couple, right? For some couples, like testing can cause some anxiety. So when I'm working one-to-one with people, I'm very aware, and I often will ask and say, look, this is a very personal choice. If you want to just start trying again, there's lots of ways we can support you. We can use progesterone support. We can get you in for an early scan. There's lots of things we can do from a sort of lifestyle and support perspective. Even if you don't want to run any testing, that's absolutely fine. You have to be led by what feels right for the couple a lot of the time as well.
And I love that you mentioned progesterone. So talk to us a little bit about that, because I think people are still confused on how that can help. So I know we could do a whole show on progesterone, but just basics around why we would want to support somebody with progesterone.
Yeah, absolutely. So I talked a little bit about like the hormonal sort of conditions that are often undiagnosed. So things like endometriosis, polycystic ovaries, thyroid conditions. They often, as a byproduct of the condition, the woman will end up with low progesterone. Progesterone comes from a healthy ovulation, and not all ovulation is healthy, and you really need a really good progesterone level throughout the luteal phase, and it needs to be stable and elevated for long enough to support the implantation of an embryo, all the way up to 12 weeks when the placenta takes over and starts producing the progesterone. So it's really critical. And sometimes, even if you're ovulating well, some women just really struggle due to some of those conditions I mentioned to produce a good progesterone level. And progesterone is something that is fairly easy to get hold of. It's getting easier in the UK. I'm sure it's probably easier in the States, but it used to be a bit of an issue in the UK to get hold of, but it's getting easier. It doesn't cause any serious issues, providing there are no allergies to progesterone. And it can be really supportive. In some women and some couples, there's more going on, and it's not, you can take progesterone, but it might be there's other factors at play. And that does happen. Sometimes we have couples that come in the door and we recommend progesterone support in early pregnancy, and sadly they go on to have another loss. It means that we need to look at other factors. But again, if you feel like you're in a position where you don't feel like there's anything serious wrong and maybe you just want to try again, progesterone is something you can take fairly easily, and it's harmless to, providing the right, there's no contraindications, that you can really support a pregnancy and early stages of pregnancy and implantation.
And I also recommend progesterone. I think progesterone support in early pregnancy is so beneficial. I've seen it from my patients with past loss who go on to have healthy pregnancies. And unfortunately, in the U.S., still some conventional medicine doctors do not recommend it and won't prescribe it. And I always tell my patients, if you are working with a clinic and they won't prescribe it, but you've had recurrent loss, you need to push for it and, even reach out to me or another naturopath in your area that can help you with that, because I think it's so beneficial. So I'm glad that you said that.
Yeah, it's all about advocating for yourself, right? And sometimes that's really hard to do as a patient, because you feel like you should trust everything the doctor says, and you feel like when the doctor says something, it's almost like, well, that's the line in the sand. That's the end of the story. There's nowhere else to go. And that's so not the case. And unfortunately, not all doctors are on board with the evidence based around progesterone. And it is something that patients battle with. And it's hard.
Sure. Oh my goodness. Well, I could talk about this all day, but we do have to take a short break. So we're going to do that now. We're going to hear a word from our sponsors. We're going to come back and we're going to talk more practical tips on optimizing fertility and trying to avoid miscarriage. So we'll be right back. Hey y'all, it's Dr. Kayla Smith here. I hope you're loving this episode as much as I am. We will be back shortly, but first, let's hear a word from our amazing sponsor. Trust me, it's something that you'll definitely want to hear, especially if you're passionate about fertility and hormone health. Did you know that we have an exclusive herbal tea crafted especially for fertility, hormones, and reproductive health? This isn't just any tea. It's a nurturing blend of 5 potent herbs, each chosen for their unique ability to support fertility and hormone balance. Imagine the benefits of red raspberry leaf, nettles, chamomile, antioxidant-rich green tea, white peony, and the delightful rooibos vanilla all in one soothing cup. This delicious, nutritious tea is perfect for starting your morning or relaxing in the evening. So why wait? Head on over to our website, hormonepuzzlesociety.com/fertility-tea to support your fertility journey in the most natural and enjoyable way. Now let's get back to our insightful episode and continue our hormone puzzle journey together. Hey Rachel, welcome back.
Thank you.
So let's talk practical tips. You gave us a lot of great stuff in the beginning of the show, so maybe we'll just recap, or if you have anything new to add, but what are 5 things that we can do right now to optimize our fertility and hopefully avoid miscarriage?
Yeah, absolutely. So nailing the basics. So are you getting good regular sleep? Are you eating a well-balanced diet, lots of protein, minimal processed foods? Are you exercising? All of our basic day-to-day good health and well-being. Get ticks in those boxes, and that would be my first thing. My second thing would be to look at your supplements if you are trying to conceive or suffering with miscarriage and you're a little bit older. So when we get older, we have to deal with the fact that we are not going to produce as many genetically normal eggs every month, and we want to look at everything we can do to optimize that. So high dose antioxidants, which will help that follicular recruitment stage and keeping inflammatory markers low. All these things will really help fine tune getting as many genetically normal eggs as you can. My third top tip would be, do not forget the male partner, full stop. Like, just don't forget about them. Run some testing for them. Certainly in a recurrent miscarriage picture, definitely be running some more in-depth male investigations, and don't be fobbed off with, oh, it's, everything's fine because you're getting pregnant. Like, that is not acceptable. I think my fourth tip would be to find a really good, solid, supportive fertility expert. So whether that is an acupuncturist, a naturopath, a functional medicine practitioner, a nutritionist, but someone who really specializes in fertility and is used to working with couples who are going through the same as what you're going through, and can offer you alternative options and is available when you need them. So you have that continuity of care. You have that person you can go to who is going to hold your hand and just make you feel really supported, because there's actually a few studies that have come out recently that show that actually when couples have a healthy pregnancy and they're supported through by any sort of fertility specialist, whether it's a doctor, an alternative health practitioner, whoever, they are rating people based on the experience, whether or not they fell pregnant. And so couples that even perhaps didn't have a healthy pregnancy and called time on their journey to conceive are still giving really good feedback to people they might have worked with if they felt like they were supported. So I think how you are supported on this pathway is so important to how you feel about it, no matter what the outcome. And I think just finding that person is really, really key. And then I think finally it would be kind to yourself. This is not your fault. And look after your mental and emotional health and well-being.
I love all of those tips, and I completely agree. All so valuable and relevant. And one thing that we didn't touch on was the stress piece. So let's just touch on that for a second. How important is it to... Well, we can't eliminate stress, but we can manage and keep our stress, our nervous system calm. So talk to us about that for a second. How important is stress management?
I mean, it's so hard to measure stress, right? And I think when we talk about stress, actually what we're talking about is that person's physiological response to stress, because some people can be faced with what the majority of people would perceive to be high stress situations, and actually they're not showing any outward signs of stress. They're sleeping well, their digestive system is functioning well, they've got good skin, there's no signs of their body struggling to respond to stress. But yet you could have another patient who is undergoing situations or going through things that a lot of people would perceive to be low stress, but their body is not managing that well, and they're outwardly showing lots of signs of stress. So I think recognizing how your body is responding to any stress is key, and then working out what works for you to manage that. Some people like to come for acupuncture, some people like to have reflexology, some people like to go for a nice glass of wine with their friends and relax and laugh, other people like to meditate and do yoga. It's exercise, it's very different. And I think understanding what helps to relieve your stress and building that in day to day, because like you said, we can't eliminate stress. There's always going to be stressful things going on in life. And, certainly trying to get pregnant and trying to stay pregnant are two hugely stressful things on their own, let alone all the other things that someone might have to deal with in their life at that time. So, yeah, recognizing again and being kind to yourself and saying, do you know what? I am going to feel stressed, but what can I do to manage that? And how can I recognize in my body the physical signs of stress is really important.
And all those things that you mentioned bring joy to the person that is, pursuing that action. So I love to point that out. Find things in your life that bring you joy, and it's less likely that you're going to feel the stress is hard because you're just a joyful, happier person. So I love that you said all of that, and I completely agree. Amazing.
In Chinese medicine, there's a big link between the joy of the heart and fertility, and the heart has a direct connection to the uterus, which sounds completely woo-woo and balmy, but yeah, we need to find joy. And I think actually when you're struggling with fertility and loss, it's very easy for all the joy to be sucked out of your life. It's not a fun time, right? So finding the things that do bring you joy is key.
I love that. Oh my goodness. Well, I could talk to you all day, but we do have to we already took our break. Now we have to wrap up. So we're going to do that now. But before we do, first, I just want to tell you, thank you. You're just a wealth of knowledge, and I really appreciate you sharing all of that with us and our audience. So thank you for that.
No, thank you for having me on. I always love talking about anything related, to fertility and miscarriage. Like I said, I feel like my purpose is now to support people through it. So I think the best way to spread awareness is on a podcast, right?
I love it. And before we go, I would love to play a little game so our audience can get to know you personally. Are you open to that?
Yeah, go for it. Sounds exciting.
Yeah. So how this works is I'm just going to ask you a series of questions. You're going to say the first thing that comes to your mind.
Go for it.
Okay. You can pass too if you don't know.
Okay.
Okay. First question, favorite food?
Mexican, all day, every day.
Me too. Least favorite food?
Oh, goat's cheese. Can't bear it.
Yeah. Favorite vacation spot?
Croatia in Europe. It's amazing. If you haven't been, you need to go.
Oh my goodness, I haven't been there, but it is on my bucket list, and I would love it. And that's my next question: is one item on your bucket list that you plan to do this year?
Yeah, I actually just did something on my bucket list. This is like perfect timing. So I just went to Rio de Janeiro, and one of the things on my bucket list was to do the helicopter ride. But it's a doors off helicopter ride where you have your legs hanging. You can hang your legs out the side, and you go all the way along over Copacabana and Ipanema, and then you go around Christ the Redeemer. And I've got some amazing photos. So I've already ticked that off for this year. That was a pretty big one. So yeah.
That's amazing. I love that. Oh my goodness. I don't know if I could be open to putting my legs out though. Oh, it sounds very scary.
It was pretty scary, but I'm glad I did it.
Yeah, that's amazing. How about your first concert?
My first concert was Michael Jackson at Wembley in 1998. And I was very front row. And I have to say it was incredible. Yeah.
That is amazing. Oh my goodness. I love that. So cool. What a memory. I mean, oh my goodness.
Never forget that.
And last question is, if you have one, your favorite quote.
Favorite quote? Oh my gosh. There is an old Japanese saying, and it goes, I can't remember it exactly, but it goes along the lines of, it's much easier, if you're on the wrong train, it's much easier to get off at the first stop, because it can be very expensive to stay on the wrong train longer than you need to be.
I love it. That's a great one.
Life generally. I'm sure it's worded slightly differently, but you get
right. I got it. Amazing. Well, Rachel, tell everybody where they can find you and learn more about your work.
Yeah, thank you, Kayla. So you can find us at www.thefertilitysuite.co.uk. We are also on Insta, so we are at the fertility_suite. And those are the best ways to find us. If anyone wants to work with us, we offer a free 15-minute call that you can book via our website. We've also got loads of free downloadables. We have like a free fertility supplements guide, a free endometriosis guide. We've got all sorts via our website and our Insta. So if you're looking for some free support, we've got lots of options there as well.
Amazing. And I think you gave us your free supplement guide that will be in the show notes. So make sure everybody listening, check that and grab that guide. Super valuable. I love it. Well, any final thoughts, maybe a piece of advice or some inspiration you want to leave?
I think my inspiration would be just to not give up at the first hurdle. And even when it feels really, really overwhelming and like you don't have the energy to deal with what you're going through, find someone who can help you. Find that support person. Find your Kayla or find your Rachel, and just don't give up, because I have so many couples that I speak to just throughout life that say, it didn't work out for us and we gave up. And I think I wish that maybe there could have been a chance that we could have got you the family you wanted, if you'd even known we existed. So, yeah.
I love that. Do not give up. That's fabulous.
I think it's difficult with that saying, right? Because actually some people choose to give up at the right time, and that's absolutely okay. And for some people, it is a real battle. So I don't say that flippantly, but yeah, I think you need to feel like you've exhausted all your options.
And I understand what you're saying completely. And I say that a lot on this show, keep pushing as much as you want until you have your baby. And I agree, if you want to give up, that's it's your journey. You can walk it however you see fit. So, but we hope everybody on this show that they make it to the end of the journey at the exact place that they were supposed to be. And we know that that's possible. Yeah.
Thanks, Kayla.
Amazing. Well, thank you everybody who's listening to this episode of the Hormone Puzzle Podcast. We're so grateful for you. We hope you have an amazing week, and we'll see you next time. So bye for now. Hey, hang on a second before you go. I've got some fantastic free resources waiting for you over at our website, all designed to support your journey. When I was going through my own 2 years of infertility, I wish that there had been something like this to guide me. There just wasn't. And that's why I created these resources specifically for you. And here's a little secret. The strategies and the foods that I share in these resources are the exact same ones that helped me conceive, not once, but twice, even after being told that it wasn't possible. So trust me, I know these tools work. Make sure you check them out, and I can't wait for you to be my next success story. Thank you so much for joining me today, and don't forget to check the show notes of this episode. If you enjoyed our time together, please hit that subscribe button and leave us a review. This would mean so much to me, and it's how more people just like you can find our show. See you next week on the Hormone Puzzle Podcast.